Hello, and welcome to the Feeling Good podcast, where you can learn powerful techniques to change the way you feel. I am your host, Rhonda, and joining me here in the Murietta Studio is Dr. David Burns. Dr. David Burns is a pioneer in the development of cognitive behavioral therapy and the creator of the new teen therapy. He is the author of Feeling Good, which has sold over 5 million copies in the United States and has been translated into over 30 languages. David is currently an emeritus adjunct professor of clinical psychiatry at Stanford University School of Medicine.
All righty.
Hi, David.
Hi, Rhonda.
I beat you to it.
Hi, Michael.
Hi, David. Hi, Rhonda.
Hi. Today we have a really exciting show, don't we, David?
I think it's very exciting. I've been looking forward to it ever since the Atlanta Intensive.
The Atlanta Intensive. So we have two special guests. Do you want me to introduce them? Or
Yes, please do.
So our first special guest is Michael Greenwald, and he's a clinical psychologist from the Los Angeles area. And he participated in both the San Francisco intensive that you did and the Atlanta intensive that you did. And in the San Francisco intensive, he was a little shy, only went up to the stage once with a lot of encouragement. But the Atlanta intensive, he was the main person that you worked with to do personal work. And your co-therapist, who is also our guest, is Thai-An Truong, who is an amazing therapist, and she was your co-therapist, and she came from She came from Oklahoma City to the Atlanta intensive, and you tapped her to be your co-therapist, which is really exciting because she's a fantastic therapist.
Yeah, and it was a joy. I've only talked to Thai-An on the phone a couple of times, and this was just the first time we had a chance to meet as well as to work together, and it was just a tremendous joy. We had recorded the live work with you, Michael, just on your cell phone as a last-minute idea. We didn't have professional recording equipment, and we might still try to post that entirely on an optional Wednesday or Thursday podcast. We're going to see if we can get some enhancement of the audio, some professional sound improvement for it. But there's often blow-away live demonstrations in intensives, and this one was certainly one of the most amazing live demos ever.
Yeah, you described it as magical when you talked about it with me.
Yeah.
And was that your experience too, Michael?
It was, absolutely magical. It was amazing. Yeah, nice. It blew me away.
Well, but before we get into the details of the Atlanta intensive and why it was so magical and what happened, can I read a couple of endorsements?
Yeah, that'd be great.
So this is from Phil McCormick from Freeport, Maine, and he wrote, "Dear Dr. Burns, Burnsy, David, I want to thank you for all the valuable podcasts that you have generously shared over the past few years. The podcasts are one of the highlights of my week, and I eagerly look forward to listening to them. They are chock full of information, entertaining, and are a joy to listen to and share with others. Thank you for all your excellent, tireless work, and best of luck with your new book, Feeling Great. I wish you and your family nothing but the best in 2020. With warm regards, Phil." A huge fan.
Thank you so much, Phil, and it just means a lot to us to get these great comments with praise and appreciation. It means a lot to Rhonda, and it means a lot to David.
Yeah,
for sure.
Definitely. And so here's another one. Shall I read one more?
Yeah, sure.
This is from someone who doesn't want her name mentioned. And she wrote, "Hi, Dr. Burns. I recently attended one of your workshops and am now listening to your podcasts on my way to work. I love what you have created, and it has given me hope that I can become a more effective therapist, not just a compassionate listener. I am an LCSW in California, currently working with older adults who struggle with depression and anxiety. I just wanted to share a brief win I had today using a technique I learned from you. I used externalization of voices for her negative thought, 'I'm useless, I have nothing to offer.' During our role play, I played the part of the positive client. I said, 'I may not be useful at all things or as useful as I used to be, but I have a very important, useful role. I am a good friend and mother, and I'm proud of that.' When I finished saying that, tears were rolling down her cheeks. She labeled it a huge win and believed she crushed that negative thought." It worked. And I just wanted to share that and thank you.
Well, thank you so much. And that's great to hear too, because we have two audiences. One is mental health professionals, and one is the general public. 60% of you are in the general public, and you're listening to get help with your own issues. 40% of you are therapists or wanting to learn how to become better therapists, as well as help with your own personal issues. And so when we get that kind of feedback that what we're doing is leading to improved treatment and better results, that's music to my ears. Now, before we dive into your most mind-boggling story, Michael, we have two quick commercial messages. On February 9th, I'm going to be doing a one-day workshop with my dear colleague, Dr. Jill Levitt, on therapeutic resistance. Now, you might think that's a boring topic, but it's actually the most powerful and liberating topic in all of psychotherapy. It's really the secret of high-speed recovery is to learn to melt away the resistance that people have. And when you learn to do that skillfully, recovery can happen really fast. And you can join that from anywhere in the world, or you can come in person. I know you, Michael, are going to fly up in person with your son from Los Angeles for that one. And then on May 17th, Jill and I are going to give another one-day program, and you get 7 CE credits for both. And that'll be on the Cognitive Distortion Starter Kit. You all know about cognitive distortions from my book, Feeling Good, the new mood therapy, but we're going to show you what are the most effective techniques to help someone who's got all or nothing thinking, or overgeneralization, or labeling, or should statements, or self-blame, or mind reading, or mental filter, and so forth. I also want to give a shout out for Thai-An, who you'll hear at the end of the podcast. You'll hear her interacting with Michael. She's watching on but can't talk due to audio issues, but you'll actually hear her at the end interacting with Michael. But Thai-An Truong is a brilliant and compassionate therapist from Oklahoma City, and works on postpartum blues and problems with women who have delivered babies or who are pregnant. And so if you're in the Oklahoma City area, or for any depression or anxiety problem, she's a huge resource. But also she does a lot of online training. And if you want some great training from her, go to teamcbttraining.com. That's one word, teamcbttraining.com. She gives free monthly webinars. She does one-on-one training, which is invaluable. Like, you might even want to get some. Michael's thinking of starting a Team CBT center in Los Angeles, and that would be a cool thing. And Thai-An also does these awesome boot camp trainings where you get 12 hours of intensive training in Team CBT, and she offers more than that. So if you're interested, go to teamcbttraining.com, because you'll have a trainer who's both incredibly kind and pleasant, but also a shrewd clinician and a totally patient and brilliant teacher. Now, let's dive in here. I guess the story started when I went down to Atlanta. It's the first intensive I've ever done in Atlanta, and I was surprised that Michael...
Actually, I think the story started in San Francisco.
Oh, in San Francisco. Well, tell us,
Yeah. So, Michael, I wonder how many people take 2 intensives in the same year. So you were a dedicated student, and you took the 4-day intensive in South San Francisco.
Yes.
And just by chance, you and I actually happened to sit next to each other during the entire 4-day intensive.
Right. I recognized your voice from the podcast. Yeah.
Right. Yep. And I remember a couple times David would ask for volunteer, and I'd kind of nudge and go, "Hey, Michael, why don't you go up there?" And most of the time you said, no, I'm not ready. But finally, on the 4th day, you did go up. Mm-hmm. And tell us about that experience.
It was for the externalization of voices exercise, and I think there were about 3 of us who went up, and you were doing the exercise with another therapist and firing our negative thoughts about being about that we expect from patients as a therapist. And
negative thoughts that therapists have, like I'm not good enough and stuff like that.
Right, yeah. Negative thoughts we would have as a therapist. So you would take on the role of of patient or of our negative thoughts, firing them at us, and we would defeat them. And that was pretty exhilarating and pretty powerful. And I was just full of anxiety and just shaking. But I was glad that you nudged me to go up there, and it was a good experience and motivated me to try and do more of that, to push myself.
Yeah, I remember when you came back to sit down at the table, you were really excited.
Yes,
and
I was.
very happy that you went up to do that work with David.
I definitely was, yeah.
And so then when you went to Atlanta, you were motivated to do even more work.
I was.
Tell us about that.
Well, I had something in mind. I knew that David did the like 2.5 hour therapy demos the first night, and I'd seen that done, and it was just so impactful and so moving. And I thought that would be a once in a lifetime opportunity to do that, and I had something in mind to work on. So I had it in mind to see if, when he asked for volunteers, if I could, I would push myself to volunteer, even though I was pretty terrified to do so. It just so happened that we had a little chat at breakfast, and the discussion came up about the demo, and he asked me to give him a daily mood log later in the morning, and I did so, and he reviewed it with Thai-An and thought it'd be a good one, and then we decided to go forward with it.
But remember the question you asked me at breakfast?
Yeah, I had just told you that one of the concerns I would have, part of my really high level of anxiety about doing a therapy demo would have been, would it be helpful for the audience, for a therapist there for the training, that I would be worried maybe I wouldn't do a good enough job, that it wouldn't be a good learning experience for the therapist. That's one of my anxiety thoughts.
Yeah. Well, I'm sure went in the extreme opposite direction. I would say that by the end of the live demo, literally half of the audience was sobbing.
Mm-hmm.
It was just totally mind blowing. But let's take it step by step.
Sure.
So you had handed me a daily mood log, so the upsetting situation was well defined, and I think it's really important when you're doing therapy, whether you're a patient or a therapist, to focus on some specific thing, because all the patient's problems will be encapsulated in any one moment of upset. And the moment you had chosen was a time trying to talk to your 27-year-old son who's applying for graduate school, and you couldn't get any very kind of deep conversation going. It was all superficial, like, how are you coming on your application, son? Fine, Dad. Do you need any help? Not really. Are you getting them in on time? Yeah, everything's under control. Kind of like that. And then you said in a very sad way, I don't know if you were tearful just that point, but that you'd never felt really close to your older son or to either of your sons, and felt kind of like a failure as a father, and that this was because of pretty severe social anxiety that you've always struggled with. Mm-hmm. And that when you'd be with your sons, you could never think of anything to say, and you're feeling very anxious, so then you'd go off into another room and leave them alone, and that you've been beating up on yourself and kicking yourself, saying things like they deserve a better father, and you maybe even have that.
I do. I have his daily mood log right here.
Yeah, let me just take a quick look at that. Yeah, and telling yourself things like, I'm failing him as a father. Something is wrong with me because I can't talk to my son. I'm inadequate as a father. He deserves so much better than me. I don't deserve his love. I'm negatively affecting his life. He must wish he had a different father. I should not have become a father because of all my defects or deficits. His problems are all my fault. And then one that we never got around to, I'm not going to do a good enough job in this demonstration to make sure it's helpful for David and for the audience. And your belief in these thoughts was very strong. 90% and 100% and 85%, and your suffering was pretty intense. You were feeling, sad and down and depressed 85%. You also said that there have been many times earlier in your life when you went for therapy, when you took antidepressants, and that you'd never really gotten any meaningful help, and that you were feeling anxious. Looks here like 65%. Is that all the anxious you were in front of the audience?
No, it was probably more like 95%.
Yeah, I think that was a typo.
Yeah, well, I was filling that out before the.
Before you got up on stage.
Yes.
Oh, yeah.
Right.
And then guilty and ashamed, 90. I forgot to circle the specific feelings, but inadequate, 90%. Lonely and unwanted and alone, 70%. Embarrassed and humiliated, self-conscious, foolish, I guess, 90%. Hopeless and discouraged, 85%. Frustrated and stuck, 95%. And the only one that you didn't indicate was anger, although you might have been angry with yourself. So the intensity of the feelings was great, and the only small teaching point there is that you're a perfectly friendly, delightful, kind of handsome with it looking guy, and so if you interacted with Michael, you'd never know that he was that you were dying
Right, you're very
inside.
self-composed and calm on the appearance on the outside. You'd never known that you had that much anxiety just looking at you.
Okay. Yeah. Thank you.
Yeah.
Yeah.
Or even just chatting with you casually, you'd never know.
Right. Yeah. I hide it well.
So can you tell us just a little bit about how this social anxiety had affected your life up to that point?
Well, I'd absolutely had it my entire life since childhood. So I was always considered very shy and quiet and withdrawn, and I really tended to isolate and stay on the periphery in social settings, from childhood through adulthood to the present, let's say to November 3rd, and anyway, of this year, just before the demo. And would let other people do all the talking, and would want to avoid situations, would always be very self-conscious, fearful of negative criticism or judgment, would always imagine people are probably not liking me or thinking negatively about me, and just tremendous anxiety across all social situations. Even getting together with like a group of friends that I've known for years, I would still be apprehensive and anxious for going, and then for a while till get kind of warmed up. But definitely with strangers, be very highly anxious.
And even with family members, wife, sons, sounds like just that you were kind of really alone, and some loneliness there.
Yeah, absolutely. I wouldn't open up with my family. And this example, talking with my son about he's applying to internships. He's fourth year grad student applying to internships. An example like that, I would want to engage with him, but I would be inhibited and reluctant, and come up with these little, I would consider poor ways of trying to initiate a conversation, and then I'd kind of give up pretty quickly because I would just feel like I can't do this, or I'm doing it wrong. And so very hard for me to get close with my family members as well. Yeah.
And then on top of that, it sounds from your daily mood log that then you kind of felt depressed about that, and ashamed and guilty, and felt like a failure as a father.
Yeah, very powerful feelings like that for the duration of my kids' lives. Yeah, I've felt like an inadequate, poor father. Yeah.
I can imagine it took a lot of courage on your part to get up in front of, there were more than 100 people at that workshop.
Yeah.
Was that tough?
I was terrified, absolutely terrified. I had to push myself harder than I ever had to go ahead and do that. And I remember clearly I was up there and literally trembling and shaking with anxiety, and my voice was, I think, showing it. I don't know how anxious I felt, but I felt like I must have looked at a 90% anxiety. I certainly felt that way.
So this was a real thing. It wasn't
Yes.
some role play, and it was severe.
Yes.
The intensity of these emotions was as high as you would see at the Stanford inpatient psychiatric unit with patients who were hospitalized undergoing electroconvulsive therapy, that they would also have, 85, 95, 100% on a lot of negative emotions, and it was chronic. It was all of your life. And the reason I say that is because, I run into a lot of grief and kind of frustration trying to tell people that we have a new treatment breakthrough, that people can often recover now in very quickly, far faster than in the old days, sometimes in a single session, and not only get rid of severe depression, but get rid of it completely, and even more, get catapulted not only from depression into really a state of enlightenment or euphoria. And when I say those things, and you've been in the audience hearing therapists badmouth me, just saying, "Oh, that's BS, and that can't happen," and this is a lot of malarkey, and that's painful for me, but also a bit irritating because I get the feeling, I probably set it up. It's probably my own fault that therapists they're not sometimes not open to something radically new, and also to learning that maybe what they've been doing isn't the best that we can offer people. But I know even you told me before we started that you had a lot of doubts too.
Right. Yeah. I mean, some of it sounded too good to be true. I admit it. Yeah. But
Right, and here you're talking about something that you've been dealing with your whole life, and then David is saying, just come up on stage and in 2.5 hours you'll be cured. That must have been really hard to believe.
No, I didn't believe it. I hoped there'd be some benefit for sure, and I was hoping and wishing for something beneficial, but I had no expectation it could be what it turned out to be. That I never could have hoped for that or predicted that. It was incredible. It remains incredible.
How it evolved, we did kind of on stage read this, and then we did our testing. T equals testing, and then we go into E equals empathy, and then we go into A, assessment of resistance, and then M, methods, TEAM. So tell us what happened during the empathy part.
The empathy part was phenomenal. So I was sitting between you and Thai-An, and you had just started by asking me to talk about what was going on, and we talked about some of the feelings. But the way the two of you would do the thought and feeling empathy was just phenomenal. And you had different styles, and each offered a different sense for me, a different benefit to me, I guess. And I think Thai-An's just compassion and gentleness just came across so strongly to me. And but with both of you, I ended up feeling like I can also say 100% safe and secure that I could really open up, which is something that personally as I never do in my life. To that extent, I've never done even in personal therapy at that level. But I felt like I could with the two of you, even with the audience there, which just strikes me even now as strange that I could feel that way. But the way the two of you empathize with thought and feeling empathy just really brought me to that place that this is completely safe, and I trusted you, that there wouldn't be judgment or criticism or a harsh reaction that I would expect otherwise.
You mentioned two terms that most but not all of the audience will have heard about, thought empathy and feeling empathy. What is thought, and what are thought and feeling empathy, and then how did Thai-An or David make you feel safe in front of a group of more than 100 people?
Right. Well, thought empathy, as I understand it, is essentially repeating back to the person, kind of paraphrase, using their same words, what they've been explaining to you, what they've been describing, how they've been thinking about things. And then the feeling empathy, you're acknowledging some of the feelings they've told you about, and maybe even offering up some other possibilities of what you imagine they might be feeling in those moments, and kind of checking it out with them and seeing if you got it right, if you're accurate about that.
Those are very humble skills, and yet most therapists think they can do this, and they can't. If they were using my empathy scale, most therapists would get failing grades initially from most patients in most sessions. But thought empathy is something as simple as saying, Michael, it sounds to me like you've really been feeling like you're failing your son. as a father, and that you're inadequate as a father, and those thoughts seem almost totally, absolutely true to you. And it sounds like when you're thinking that, you're just feeling anxious and guilty and ashamed and inadequate and down and really discouraged. Am I reading you right?
Yes.
Now that doesn't take a lot of genius to do that. I just read here two things you had on your daily mood log and just read off several of your feelings. But that's all it really takes. You don't have to get involved in fancy interpretations or saying something to impress the patient. But you said there were other things that I was doing, and especially that Thai-An was doing, that made you feel safe. And I remember how we got into this, like there was this cone over us,
Yeah.
a glass cone,
Yeah.
that we were safe in there. How did that get created, and how important was that?
Well, it was of vital importance. Like I said, it was almost like the audience no longer existed. It was really incredible. I was at first so aware that they were there and so anxious about that, and they just seemed to fade away. And it was just being with the two of you. And I just had the sense you were really right with me with the emotions, with the feelings, and the way Thai-An would speak. It just felt like from her heart about how she felt about what I was feeling. She added that part too, which was really I connected with, and acknowledging what I was feeling and offering up other possible ways I was feeling. She was just so right on target, and again with the sort of warm, compassionate way she expressed it.
How to put that technically, she was
Sure.
using I feel statements, and that's how you go beyond just thought and feeling empathy into a warm, compassionate human connection. What kind of things did she say that she was feeling that connected for you and felt compassionate?
I think she said at one point like it touches my heart, and I think she said like I feel sad hearing you say this, like when I was talking about how much was hurting, not having the kind of connection with my sons I wanted. That's what I recall offhand.
Yeah.
Kind of how it was affecting her
Yeah.
personally.
And that's so important. In fact, afterwards, I talked to a colleague, Jeremy, who I'm working on this Feeling Great app with. We're hoping to create something for people. But when I told him about your story and your daily mood log, he says tears started going down his cheeks.
Wow.
Just hearing the loneliness that you'd felt, and at the same time having so much love for your son. Some people say, oh, he felt like a failure as a father. He must have been beating his sons or some horrible thing. But this was the most opposite thing in the world. That I can't imagine a more loving father than you, and yet feeling like you had failed them. There was just something about that was so touching, and I think that's why the audience felt so connected to you, because of your humility, your warmth. There was just something about that was. Well, I'll shut up. Rhonda will say what I'm trying to say.
I mean, it just feels so universal. That I mean, just sitting here listening to you, and I have two sons, and I have felt that. I've felt that fear, and I felt awkward in moments when I thought, oh, I don't know what to say. How can I reach them? And that yearning to be close, and
Yes.
the barriers for that. It just, you described Thai-An as saying that it really touched her heart, and it just really breaks my heart to hear you, having gone through that with them, their life and your life, and
Yes.
you not being able to reach the goal that you wanted.
Right.
It sounds so painful, and I
Yeah.
think
Takes so
every
mu-
parent can relate to that.
It
Yes.
takes so much courage to say, I feel like I'm failing my son.
Right.
Yeah.
Like, who would ever dare to say those words?
Yeah.
Yeah. It's a very tough thing to acknowledge. Yeah. Even though I felt that way for a long time.
And I think when you were so open and so vulnerable, I think you just kind of captured everybody's heart. I think people were just already beginning to feel in awe of you. When they heard more of the story, it became even more intense for the audience. Well, after and when Thai-An interviews you at the end, and people can hear her voice and talking to you, she may have some more questions or comments on that. But that was certainly great. And then after you gave us a high grade on on empathy, we went on to the what we now call A equals assessment of resistance. We used to call it paradoxical agenda setting, but I tried to give it a simpler name, and that's where we find out, what the client wants help with, and try to bring the resistance to conscious awareness and melt it away. And we asked you, essentially what you would be hoping to get out of the demonstration, and essentially I think the answer was that if it'd be possible to make all of these negative thoughts and feelings disappear, and all this horrible social anxiety just disappear, that would be the miracle you'd be hoping for. And then we went into the familiar thing of, there's no magic button to press to make it all disappear, but we've got powerful techniques and can probably make a dent in it, and could make it entirely disappear tonight, but maybe that wouldn't be such a good thing. And then I think you were, well, why not? I mean, this is what I've been waiting for, is to get cured. And then we did what's called positive reframing, which was taking each of your negative emotions, and I think you have our list there printed out too, and maybe we can just see what this part of it meant to you. Before we make all these negative thoughts and feelings disappear, maybe we better talk about what's really positive and awesome about them. And this started
about positive about his thoughts,
about your negative feelings. What's
and
great
thoughts.
about your shame, your sadness, your feeling of inadequacy, and your feelings of worthlessness, and all these things that we're taught these are symptoms of illnesses, like social anxiety disorder, or some other mental disorder, according to the psychiatric DSM-5 that lists all these hundreds of mental disorders that we have. We're trying to say what's actually good and awesome about these things, and what made that part of the evening so great was you didn't get it at all at first.
No,
it just wasn't making sense. And as we went through this, it started to come more and more alive, and then you suddenly got it. Can you talk a little bit about the list, or what happened to you at that point?
Yeah, well, you started with the depression and sadness, and kind of said that there's some positive and awesome things this shows about me, and some real benefits to having it, and you asked, what could that be? And I remember vividly sitting there and crying at that point, and just said nothing. And I was, even though I'd seen this in the workshops, in that moment it was nothing. Nothing came to mind. It was just that pain, which I just wanted to be just gotten rid of. And then the two of you sort of helped bring that out and prompt a little bit and ask me questions, and then it started coming out, and I started seeing it little by little with the different emotions, and then as you said, it kind of got rolling, and more just would come to mind, and that really clicked, that there are these positives.
Can you remember the things that began to click?
It might have been like with the shame and the worthlessness.
Yeah, talk about what was really wonderful about your shame and your worthlessness.
Well, I think you would ask me a question, and what different questions, and giving me options. Are you somebody who is sort of in denial or realistic? And I'd say, well, I tend to be more realistic. And you would ask, is that reflected in like your feelings of worthlessness? Are you realistic? And I would say yes, and then that really clicked. And the way you would then ask the follow-up questions is it true about me? And I would say yes, and then and is it important? And I'd say yes.
So it began to dawn on you that you're feeling worthless. Instead of viewing that with shame, like we're taught to by society, that's a symptom of an illness.
Right.
So you shouldn't feel that way. That's bad to feel that way. We're saying
Right.
it's great to feel that way. And one reason is because you do have flaws, and this shows that you're willing to be realistic.
Yes.
About your flaws. Is that good?
Yes, that's great.
Is that important?
Absolutely it
and
is.
then what else does this show about you that's positive and awesome?
That I'm accountable.
Is that important? Instead of blaming your sons or blaming other people, you're looking inwardly?
Yeah, it's super important.
And what else is great about feeling worthless?
It reflects that I have high standards.
Is that true?
Yeah, tends to be true. I do have high standards.
And have those motivated you?
Absolutely, they motivated me to even get up on stage.
Yeah, exactly.
Yeah.
And then that you feel ashamed of your role as a father, ashamed of your failures with your son. What does that show about you that's positive and awesome?
Well, I'm aware of my shortcomings, and I value that relationship.
Yeah.
I want that relationship to be as good as it can be.
It shows your love for your son.
Right, shows my love for my son.
Is that real?
It's very real.
Is that important?
It's incredibly important.
Is
yes.
that powerful?
Incredibly powerful, absolutely.
Yeah.
Yes.
And then your shame and feelings of worthlessness, does that show you as a very arrogant person or as a humble person?
A humble person. Yes.
Is that important? Is that desirable?
It is to me. Yeah,
Is
I
that
think
a
so.
spiritual quality?
Yes, I would say it is.
And so on and on like this, and and this is just the tip of the iceberg. And we'll post the show notes. So if you go to feelinggood.com, if you go to YouTube and you don't get the show notes, go to my website feelinggood.com and click on the podcast link, and then you can link in and get all these beautiful show notes, and you can see the daily mood log and the before and after testing and the positive reframing table. But so as we began to say what's great about all these horribly, presumably negative feelings, what impact did that have on you?
Things started to, it felt like a kind of an opening up and a lightening up. I felt something inside kind of shifting. It's hard to articulate. It's hard to put into words that really describe it. It created a sense that something can change here, that there's a sense of hopefulness, really, was also coming with that.
Yeah. And it also helps you shift to see what you've been trained to think of as psychiatric symptoms of mental disorders that you're ashamed of, this illness due to a chemical imbalance in your brain or a personality defect or a problematic childhood or for whatever reason that is bad, that to view all these things as good and to take a pride in feeling ashamed or worthless or feeling sad and depressed and anxious. And it's really one of the profoundly new and powerful things about what we're calling team therapy or team CBT. Actually, we have a new name for it now.
Oh, what's that?
Well, I think I mentioned to you, we're at least for the app that I'm developing with Jeremy, we've decided to just call it Feeling Great Therapy, because that's something the general public can understand instead of all these technical terms.
Yeah.
And people want to feel great, and
Yeah, they do.
that's
That's
kind of
awesome.
what it's about.
And you're talking about Michael's, on the path to feeling great. So, and that sounds really cool. So after you talked about all the positive attributes that these really challenging feelings brought out, did you also talk about the negative thoughts that you had?
We'll do that in a second. But to bring that to conclusion. Oh, you mean did we positively reframe the negative thoughts? Oh, yeah. I'm sorry. I'll shut up.
So, I mean,
question.
did you go into what the negative thoughts said about you that speaks to your core values or maybe are protective or really, beautiful aspects of who you are?
Yeah, we did. I think we may have gotten to one or two. It may have, I don't recall which one. It might have been that I'm failing him as a father, or we may have done that. And it reflected that, again, some of those other core values of being realistic, wanting to be aware of my shortcomings, that I love him and I want to really do my best for him, that I'm got realistic, honest, accountable.
And that I recognize there's something missing here.
Right.
Which I can work on and bring my relationship to my son to a much higher level as well as maybe everyone else.
Yes, right. That some changes are needed, and I need to work on some of this.
Yeah,
so that I can.
And that there's truth in that.
Yes, absolutely.
That's cool.
Yeah.
Did you have a sense of feeling more relaxed as you were going through this?
I did. Yeah, even though I was feeling some very, very powerful emotion. I was getting more and more relaxed, and the kind of anxiety I had, sort of a performance anxiety at the beginning, really had faded away. It was remarkable. Yeah, things really shifted and did get more relaxed. Mm-hmm.
Then we did our magic dial. Instead of pressing a magic button and making all these things disappear. We said, suppose you had a magic dial and you could dial these things down, since there are good things about your sadness. After all, it's appropriate to be sad if you don't have the relationship with your son that you want. And if you weren't sad, it would show you didn't really care. And the sadness shows how profound your love is. And then, so he said, how much sadness would be ideal at the end of the demo? And you said, well, 20%. And so if you go to the show notes, you can look at the second version of the daily mood log with these things written in there. You thought reduce the depression from 85 to 20. You'd like to reduce the anxiety from, well, I just wrote here 95, which was on stage, to 15. And the guilt from 90 to 10. 10 would be enough guilt and shame. And the feeling worthless and inadequate, instead of 90, you'd want 10 would be enough. And 10% would be enough loneliness. And 10% would be enough feeling foolish or humiliated or self-conscious or embarrassed. Go from 90 to 10, ideally. And then hopelessness and discouragement from 85 to 5. And then feeling frustrated and stuck and defeated. 95%, you'd want to go to 5%. And that's the end of the A equals assessment of resistance. We've brought the resistance to awareness and then lowered the resistance. And instead of aiming for a complete elimination of symptoms, we're going to just aim for reducing them. But that's a trick that we've played on Michael. We've made a deal with your subconscious, and we said, okay, we'll lower the sadness to 20 and no more.
Right.
So now the patient, the client, doesn't have to fight against you. The client is in control, and the subconscious mind has said it's okay to lower these feelings to these levels, and at those levels you can still keep the really good part without having such intense suffering.
Yeah.
And now we're ready for the last part of the session, which in a way was equally or even more dramatic, where we began to look at the distortions in the thoughts and to challenge them with a variety of techniques, especially externalization of voices. And this was also cool because the first thought we were trying to get you to challenge and crush, you were kind of getting it, but not completely getting it.
Right.
And we had to do a couple of role reversals, which always happens until it suddenly hit you like lightning, and it kind of catapulted you into enlightenment. Can you recall that experience? I think we were working on I'm as inadequate as a father, or I'm failing him as a father. Something. I'm failing him as a father.
Yeah, it may have been inadequate as a father.
Okay.
Yeah, and doing the externalization of voices part. That's what you're referring to. That part of the methods. Yeah, it was challenging, and I think at first it really helped having done the identifying the distortions. That gave me some kind of ammunition there. But
well, let's start there. What are the distortions in I'm failing him as a father, or I'm inadequate as a father?
I had put all or nothing thinking.
Tell us why.
I was probably thinking it's either fail or succeed.
Yeah.
And it's not an all or nothing. It's not black or white. It's more of on a continuum, or how well am I doing, rather than failing or succeeding.
Yeah, and sometimes we're doing great, and sometimes we're doing crappy,
Right.
and most of the time we're somewhere in between.
Right. Yeah. And then I had mental filter. I was probably just focusing on the negatives and overlooking positives that were there as well.
Discounting the positives. So were there any positives there as a father?
Now that part was really powerful in the workshop. I remember that distinctly. You asked me that, and there were. I said, yeah, there's some positives, and I think I said that I've done some good things, or introduced him to some good things in his life that he still treasures to this day. And you asked me about that, and I shared with you different activities that I kind of introduced him to. And that was really powerful for me.
What was on the list?
It was things like astronomy and whitewater rafting and rock climbing, camping, scuba diving, snorkeling, skiing. I think those were a lot of them. Different activities that I did with him and that he continues to do, and I think he really has enjoyed and treasures in his life.
Yeah,
Yeah.
what a fantastic
Yeah.
father-son connection. Can you
Yeah.
imagine how much you would have done if you hadn't been a failure as a father?
Yeah, I would have been.
Like I'm thinking, gosh, I didn't do any of those things with my son. I should have.
Yeah.
And then you also said that I'm always there when he needs me.
Yes.
And then still I have shortcomings and I can improve on my shortcomings.
Yes.
So that's just the all or nothing thinking and the mental filter and the discounting the positive. Also, you had that this was a hidden should statement and self-blame and labeling. How does that work?
Well, the labeling was like a failure. So I'm slapping that label on myself rather than looking at specifics.
Yeah.
Where maybe I could have done better, or it didn't do something that I could have done that would have been important. And then let's see, what else were you asking
Well,
about?
it says a hidden should statement.
Oh, I guess it's that I shouldn't make mistakes, or I shouldn't have shortcomings, or I should do better in this way or that way. Yeah.
And you also said self-blame.
Yeah, I was taking all the responsibility for anything that I may have perceived to have not been representative of being a good father.
Was it also, I think you said mind reading?
Yeah, absolutely. I was thinking, he was thinking maybe I was not a good father. I even had some negative thoughts, thinking that he wished he had a different father. And without any evidence, he's never said anything like that. Yeah.
Then we did externalization of voices, and in this technique, one of us plays the role of the negative Michael, and you play the role of the positive Michael, and then we battle back and forth until we blow the thought out of the water. You want to be the negative Michael, and we can try it right now?
Sure. Can I have one?
Sure.
So I'll be so it's not Rhonda talking, it's your negative voice talking, right? You know,
Yes.
Michael, I'm sorry to tell you this, but something is wrong with you because you can't talk to your son.
Well, it's not really true that I can't talk to my son. I do talk to him more and more, and sometimes I have struggled with it, with opening up to him and sharing myself, and that's been kind of a mistake I've made on my part, feeling like it wasn't okay to open up to him, that I wasn't good enough in what I would say or express to him, and that's really kind of nonsense. And I can talk with him much more freely now and not worry so much about that.
Nice. And who won that?
I did.
And did you win that small or large?
Large?
Large or huge?
I'd say it felt huge.
Yeah, it
Yes.
sounds like it was huge.
Yes.
Now, let's make a teaching point. That was
Okay.
well done, but sometimes people hear something they didn't grasp it. You say, something is wrong with me because I can't talk to my son. And everyone listening who has depression does this. Maybe it's not, you don't say, well, because I can't talk to my son, but they're saying something's wrong with me. I'm not good enough for this or that reason. And then we were using the technique called let's be specific. And this is a Buddhist technique because our suffering, according to the Buddha 2,500 years ago, is all in the clouds of abstraction. And once you get down to the specific thing, the suffering disappears. See, when you say something's wrong with me, it's like you have a self that's defective, and that's depression. That's the definition of depression. But there is something that's wrong with you, but when we name what it is specifically, what the real problem is that you have intense social anxiety, and instead of opening up and sharing it with people, you hide it.
Yes.
And that's the only specific error that you're making.
Yes.
That's all there is to it. There's nothing more to it.
Right.
And that's something you can stop doing at any moment, including you're doing it right now at this moment.
Yes, I am.
And that when you correct that thing, you go into enlightenment. And this sounds overly simple to people.
Yeah.
but it always is this simple.
It sounds simple, but it's not simple because Michael had to have the courage to come on stage and
Yeah.
face his fear.
Right,
Yes,
right.
And it sounds like they were tremendous fear.
absolutely. It was, yeah.
But then you got tremendous reward at the end of the work.
Huge, way more than I ever could have expected.
Well,
Yeah.
let's go on to where this then went. So that
Okay.
we did all this externalization of voices and knocked these negative thoughts out of the park.
Yes.
And then and that itself was really pretty mind-blowing for you suddenly to see it's not that you're defective, it's just that you're not opening up.
Right.
And again, I can stop this thing at any instant I choose to.
Yeah.
It may be have me scared shitless.
Yeah,
I didn't use that
sure.
term, but I might have had to
You
use
did.
and it might be scary, but that's what the Buddha talked about. Confronting the monster. Enlightenment comes when you confront the monster and you discover that the monster has no teeth. But we didn't know that for sure yet, because here's all these 100 people that you're pretty sure are judging you and
Right.
thinking you're a bad father.
Right.
And so what did we do then, and what happened?
It was unbelievable what we did then. I thought, well, you asked me, I think, how are they reacting to you, or how are they feeling about you? And of course I had to say, I don't know. And I think you asked me, well, how do you find out? And I said, well, we asked them. And so then you said, well, why don't we go ask them? And this part I did not anticipate. So we take the microphones and we walk down into the audience. And I can't recall at that point, I think you may have asked if anyone has anything they want to say to me, and somebody would raise their hand. We walk over to them. It was something like that.
The first one was a woman, I think. And
It was
then
a woman.
guy.
Mm-hmm. Yeah.
And then you asked her, are you judging me as
Right. I said, I've opened up. I've shared a lot of really painful thoughts and feelings with you, and what do you think of me, or are you judging me? And she just had tears rolling down her face, and she just said she felt so close to me, and I think I can't recall exactly what she said, but she was very moved and felt like she related to it in some way that
Well, she was saying she'd always wished she'd had a father like you.
I think she was saying something to that effect, actually. Yeah. And that it had been a very closed off relationship, I think she may have said.
Yeah.
Yeah, it was
How
very
did
moving.
that hit you?
I then was crying also, and it just moved me tremendously inside. Yeah, I almost couldn't believe that it had this impact, and that she was expressing these thoughts and feelings to me. It was so powerful, it was so moving. Yeah.
And then there was a fellow, and I said, well, this guy looks pretty judgmental.
Yeah.
He's probably thinking you're a bad father. Ask him.
Right. And I think what you first had me do with him was to say to him what I've been unable to say to my son.
Oh, really?
Yeah. Do you remember that?
No, tell me. It sounds very creative and important.
Well, it was. So you had me talk to him as my son and express what I have not been able to express. And
Oh,
so
wow.
kind of a role play. And he had the microphone, but he was just listening at first. And
What did you say?
Well, I said, I've had a hard time expressing my love to you your whole life, and I just need to tell you that you mean the world to me, and that I'm so proud of who you are and the person you've become, and I'm sorry I've always had a hard time expressing this to you, but it's really been my own anxiety and nothing about you that I've had a hard time saying this. But you're just a wonderful person, and I couldn't be more proud of you, and I love you with all my heart. And I'm going to be sure and tell you this more going forward. And this guy was then he was crying, and then he said something to me about he was probably I don't know, maybe late 20s or 30 or something. He said expressed something that he was having some conflict or distance with his father. And then he went into a role play kind of about his feelings towards his father with me. And it was just, there was just this connection, and it was incredibly powerful. And I think we both had tears running down our face and hugged. And it was just so moving. It's
He
amazing.
made some contact with me after the workshop too. I can't remember who he was, but he'll pop into my mind probably an hour or two from now. But it was just, he said, one of the most mind-blowing experiences of his life.
Yeah.
I wasn't there, but listening as both a parent and as a child of imagining my own father saying something like that, and then saying that to my own son, it's just so impactful, just so meaningful, Michael. It's
Thank you. Yeah.
it's awe-inspiring.
Yeah. Thank you.
And then it might sound corny, but then the audience just started erupting like popcorn.
Yeah.
And people all over were just sobbing and
Yeah.
and just saying how much it meant to them.
Yeah.
What you had done.
Yeah.
That night. And
It was
then
amazing.
You were saying what happened the next few days in the workshop.
Yeah, it was incredible. I mean, beginning that night after the demonstration, and then the next 3 days, people on their own from the workshop would come up to me and just either just express how touching they found it, how moving it was for them, that it meant so much to them, or say something that just made me feel incredible. They would say that it inspired them to talk with their parent or their adult child and about things, that there had been some conflict or distance, and that they're going to talk and get closer again and reconnect. And that was just that meant the world to me. It was so cool.
Yeah.
So and in the hotel elevator, there would be these elevator talks. I'd get on, and then a couple other people from the workshop would get on, and they'd bring up something, and we'd end up having to hold the door at the next floor because the door was trying to close, and we were still talking, and it was so funny that people would catch me in the hall. It was just such a cool experience.
We'll give two quick things here, and then we'll let Thai-An take over. We'll make a formal goodbye because we have to change the microphones for the next segment. But two quick things. One is that I like doing this kind of work because I think there's a spiritual aspect to it, and I don't mean religious in the sense of any religion, but more the concepts that are at the basis of most, if not all, religions. And one of the things that I think is so miraculous is when you open up and take out of the closet the thing you've been hiding in shame as the worst part of yourself.
Yeah.
It turns into the best. Your worst turns into the best. Your mud turns into gold. And what you had been hiding all of your life allowed you to have this amazing healing effect and connecting effect on nearly 100 people simultaneously. And then you can talk with Thai-An too about what's happened since that time, or whatever you two want to chat about. But another thing is that you had told me that you didn't believe that it was true that you could not only get out of depression, and again, your scores at the end of the session were just pretty much everything was a 0 or 5% or some trivial amount.
Right.
That you hadn't believed that one could actually be shot into what we would call enlightenment or joy or something. Can you just comment on that?
Yeah, that's absolutely true. I'd been struggling with depression basically my entire life, and tried different treatments that were minimally helpful. So I didn't really believe, I really didn't. I had hopes that this would be beneficial. I didn't believe you could come out of it and even above that have feelings of joy and high levels of happiness. And it really happened. It did from that night and remains today. And I've taken the brief mood survey since then, and the depression score is like 0, and anxiety is like 1 or 2, and the happiness levels are really high. And I've had feelings of joy. People always talked about joyous and feeling joy, and I have a concept of what it was. I don't know that I've ever felt true joy. Maybe moments, peak experiences here and there in my life, but like joy on a daily basis, I've never had. I don't think I've ever felt this level of joy and really knowing what it means to feel joy. It's unbelievable.
Wow, that is
So
incredible.
you're saying it is possible that using some of this quackery that David has developed and shamelessly promotes, that it is possible to eliminate a lifetime of depression, sometimes in a single session of in this case, little over 2 hours, including a lot of teaching along the way.
Yes.
And not only get over depression, but actually experience joy and enlightenment.
Yeah, I know firsthand it is entirely possible. It really happens.
Yeah.
And it
And
does.
could this happen, you think, for other people who are listening right now? Because there may be thousands, 10,000 people could be listening
Yeah.
to this or more.
It can happen for anyone. I'm absolutely certain of that. Yes.
Well, thank you. My last thing is you can't work a miracle for someone else without working a miracle for yourself. And I can just tell you that you've brought incredible joy into my heart, into my life as well.
Thank you.
Appreciate that.
Thank you.
Me too. I'm sorry I wasn't there, but even just being able to share it in this brief time, it's, like I said before, it's inspiring.
Oh, thank you so much.
Yeah.
And if we can get the audio on the cell phone recording of that, plus the relapse prevention training you did on the fourth day for, I think, 15 minutes or,
Yes.
or something, we'll see if we can publish that as an optional extra podcast for those who are interested in hearing the real thing. So now I think we'll just...
Yeah, so if you could just jump up and put the other microphone on so you can talk to Thai-An real
Yeah.
quickly, then we'll bring her into the conversation.
Hi, everyone. This is Thai-An from Oklahoma, and I am a Team CBT therapist and trainer from Oklahoma. I think I already said I'm from Oklahoma. This is our third take, so I can't remember what I said and what I haven't said. But it is truly such an honor and privilege to be here on the podcast to reconnect with Michael. I still truly feel like I have to pinch myself that I was honored with the opportunity to be the co-therapist for Dr. Burns at the Atlanta Intensive, and to really be able to witness Michael's transformation from beginning to end. There's just no words to describe it. I've shared with Dr. Burns personally that it's truly been one of the best experiences of my life to be able to just witness that in person. There was just something so magical about it. And so I think they're just wanting me to go over some of the aspects that maybe haven't been covered that I remember. And they've gone over each of the team components pretty thoroughly, I believe. So just a couple of things stood out to me. The first thing regarding the empathy was, initially it was actually maybe difficult for Michael to identify loneliness, because he actually put 0 loneliness at first. And then towards the middle of our therapy together, I saw him eventually circle lonely and put 70%. And I wondered if that was a powerful shift for Michael, and what led him to not acknowledge loneliness at all, to realize, oh, wow, it's actually at 70%. And I remember when I asked him about it, it became pretty emotional. And he said, I'm just now realizing how lonely I've kept myself. Could you speak a little bit more to that, Michael?
Sure. Yeah, when I completed the daily mood log and looking down the various emotions, I did not identify with loneliness and had put it at 0. I wasn't aware of feeling that. And then going through the daily mood log in the therapy demonstration, I think Dr. Burns noted that and asked me about loneliness. And then I did think about it for a moment and realized that because of my anxiety and worried about not connecting properly or being judged, that I really would withdraw and isolate myself and keep myself alone, and that I really was feeling a deep loneliness that I hadn't been in touch with, but it was really there. And that it was very emotional to recognize that I had been feeling very lonely, and because of keeping myself alone. Yeah.
Yeah, because I remember when we were going over the daily mood log, he'd asked you a couple of times and even kind of pressed you a little bit, like there's no loneliness that you're experiencing. And at first you actually said no, until later on it seemed to like slowly surface.
Yeah, I think that's right. Yeah, I don't remember exactly when, but it did take a little while, and I became aware that there really was loneliness deep down. Yeah.
Yeah.
I think I had trouble just maybe acknowledging or letting myself notice or be aware that I was feeling lonely. It was a painful feeling to have. I think it was probably kind of protecting myself from that awareness.
Yeah. And I think it's a pretty cool moment when you can feel safe enough to uncover some of the most vulnerable feelings that were hard to acknowledge at first, because I think in those moments I felt even more connected with you,
Hmm.
and the audience did as well, with how vulnerable you continued to be.
Right, and it was really the empathy that you and Dr. Burns provided, that sense of safety and the warmth that you were empathizing with me, that really allowed me to um, feel safe and be able to be vulnerable and open like that. Otherwise,
Yeah.
I never would have been able to go there.
Mm.
Yeah.
Yeah, that's so beautiful to hear, but I actually want to give you all the credit because I think the audience recognized that you shared that you've been socially anxious, and then we all had additional admiration for you for doing
Mm.
something as scary as going in front of 120 people to share your most vulnerable hurts and heartaches here.
Hmm.
And then I think some people in the audience even said, I actually really loved that you were shaking,
Mm.
because I could tell what courage it took for you to be up there and to just be so real with us and to be genuine with us, which is so cool to see from beginning to end. And by the end of that, you weren't shaken at all. You were confident, you were
Yeah,
smiling.
yeah, I was feeling
Yes.
great. Yeah.
Yeah. So
Hmm.
that whole transformation was so cool to witness.
Yes.
Um, the other thing I wanted to point out that was uh, interesting, and then I think kind of the most powerful part of the whole session, and I saw on the back of your brief mood survey as well, that the evaluation of therapy session,
Hmm.
where you said the best part was actually receiving feedback from the audience.
Hmm.
And I truly felt like there was just something so magical about that section with the survey method. And then when Dr.
Yes.
Burns pushed you to do more interpersonal exposure, it was like a spiritual sense of connection. And he said that half of the room was crying, but I remember looking around and there wasn't a single dry eye in the house,
Uh-huh. Yeah.
truly,
Yeah.
because everyone just felt so moved and connected, and kind of corny, but like we were one in this connection of
Yeah.
pain and healing.
Yeah, it really felt that way, and it was incredibly powerful what people said individually, and the whole audience, like you said, with the survey method, the whole audience's
Yeah,
reaction to me was so moving. Yeah, and so
yeah,
real.
yeah, yeah. It was really incredible, and I remember kind of an interesting portion when he just touched that. Dr. Burns kind of really skillfully, I think, pushed you to do interpersonal exposure. And he
Mhm.
just touched the shoulders of that young man who was like, now this is your son. You're going to talk to him now.
Yes.
And initially you were really sweet, but I think kind of surface level when you
Hmm.
just said, I love you. I'm proud of you. I don't tell you enough. And
Hmm.
then Dr. Burns kind of gave you the additional exposure push to say, now I want you to share your negative thoughts with him. And you
Right.
were actually really hesitant from my observation. You said, share these with him, my negative thoughts from the daily mood log.
Right.
And he said, oh no, don't share those thoughts, just keep hiding them.
Yeah. Right.
And I think that was truly like a great way to wrap up his message, that what you've been hiding is gold. And
Yes.
then when you did the second time around, when you said I love you, but you also went into, and I've just been feeling inadequate my whole life, and I have these fears that you think you deserve better, or that I'm failing you. And I think that was when it really touched that man's heart.
Yeah.
And then you just saw him respond like he was your son. And
Yes.
he even said, like, later on, like, the words you shared with me are the words I've been yearning to hear from my own
Yeah.
father.
Yeah.
And
It's
gosh, I think that
incredible.
was when, like, I was sobbing, and everyone else too. But I think it was
Yeah.
that vulnerability and that true push to the exposure of being even more real and raw that brought that. I'm wondering how you experienced that.
No, it's exactly like you said. I didn't expect that. I was really reluctant. It was hard enough to say what I had been saying, and then that was a whole nother level. And going through that was, I mean, such an opening up, and it's hard to put words to it, but it was so moving to me and so powerful. And I can see it was to that man as well. Um, and and uh, and then yeah, what he said back. And just that connection that I felt
Mm,
with him, with a total stranger, by opening up like that,
I
was
know.
phenomenal. Yeah.
I felt like we were all family in a moment, witnessing like our uncle and his nephew connect or something, but
Right.
it was just that powerful. It
It
just felt like
was.
we were all so close. We were all witnessing something really intimate and
Right.
touching to us personally.
For sure it was. And you're so right when you say that extra push from Dr. Burns to do that added part was huge. Yeah. Yeah, really
Yeah.
transformational.
And so from there, I want to give you more praise for really bringing that piece to your kids. Oh, there's 2 minutes left. Okay. And just really wanting to allow the audience to hear from you. You've updated Dr. Burns and I about how you've continued to be vulnerable, and you've
Yes.
opened up to your sons, your wife, and especially your mother-in-law. That story had really like moved me, and would love to give you a chance to share about that.
Sure. Yeah, I've opened up to multiple people, other friends as well. But my mother-in-law in particular, about a week after the demonstration, I had an opportunity to be one-on-one with her and just open up to her and tell her what she's meant to me and the love I've felt from her for the 33 years I've known her. That she's been like a second mother to me, and it moved her tremendously. And I was just to follow up, I was so happy to have had that opportunity because she had been battling cancer for several years, and she actually passed away December 12th. So
Wow.
I had that opportunity to share with her how I really felt about her, which I'd never had before, and she really heard it, and it really moved her. And I never would have had that opportunity. I never would have done that prior to have done this work in the demonstration, and it meant so much to her. It was just, she was cheerful, and I know she really loved me, and it just meant so much to her to have heard that from me, that I'm so glad I had the chance to say those things to her, and meant the world to me as well.
Wow, I didn't even know that piece of the
No.
update that she had passed, and
Yeah.
I'm feeling tears welling up for
Yeah.
myself here on just the amazing experience of you actually opening your heart up to her and how much that had meant to her to hear that she was like a second mother to you, and
Yes.
it wouldn't have happened
No.
if you didn't push yourself to do the exposure first and then pushing yourself to continue to do it with everyone else.
Exactly.
Well,
Yeah.
thank you so much, Michael, for just being you and giving us this gift that I think has touched all of our hearts. And thank you so much, Dr. Burns, and Rhonda, for having me on this show.
And thank you for everything.
This has been another episode of the Feeling Good podcast. For more information, visit Dr. Burns' website at feelinggood.com, where you will find the show notes for this episode under the podcast page. You will also find archives of previous episodes and many resources for therapists and non-therapists. We welcome your comments and questions. If you want to support the show, please share the podcast with people who might benefit from it. You could also go to iTunes and leave a 5-star rating. The theme music is Gypsy Jazz in Paris, 1935, composed and performed by Brett Van Donsel. I am your host, Rhonda Borowski. We hope you enjoyed this episode. I invite you to join us next time for another episode of the Feeling Good podcast.